So thank you so much for coming, and we appreciate the invitation to speak today. We have been next door for the last 20 minutes trying to find a setup, so we're thankful to be here. So this is, like Sarah said, this is a workshop that we did at Aptum, and then we've also used a little bit in Pittsburgh, and hopefully at whatever small group settings you teach in, some of this will be useful to you to continue to refine your skills. So the basic rundown for the morning, I'm just going to go over some basics for small group teaching. If we have sound, we're going to do a small group teaching video with a little bit of discussion, get some of your input about what you found challenging in the small group setting, and then we're going to sort of blow up two of the most common problem learner types and talk a little bit more about the differential diagnosis for them and how we manage them. And then we'll have a little bit of time for wrap up and other questions that we did not cover. So just to set the stage, in this small group, there are several components that are necessary for a successful small group encounter. The facilitator and teacher, which we're going to focus on today, and the learners, which we're going to focus on today. I'll talk briefly about the physical environment, but we're not digging deeply into that or the group dynamic piece, just so you know what we're getting into. So I think the first mantra of a small group is that your job as the facilitator is to guide the discussion and not to drive it. The power of a small group is that you can do higher level learning there, and if you're just downloading information into the learner, then that's going to really not give your small group the best learning experience it could be. You want to make sure that you're maintaining the exchange of ideas between the group members, and this can be challenging when you've spent a lot of time preparing for the discussion, when you've spent hours reading about the case or the topic, and you have a lot of agendas that you want to cover and things that you want to get across, but it's really trying to hold back and let the learners guide the discussion. The second mantra is paying attention. Be aware of who is and is not with you in terms of attention and understanding. So your goal again is to involve and engage everybody in the group, and you want to be sensitive if there are group dynamics that are undermining you meeting your objectives, so that you can sort of check in with your learners and keep the rate of the group at the right speed for you. The third mantra is prepare. So knowledge is power, and I think confidence is really important in this setting. The more confident you are, the more equipped you are for a small group teaching setting, you're going to feel a lot more comfortable. I think it's also helpful if things bomb to have some information to fall back on to keep the discussion going. If your learners really don't know what's going on, or if they come up with a sidebar question on a case that may not be the thrust of the case, you want to have some backup information that you can use to teach the students. Again, you want to so the goal of the small group setting is getting at a higher level of learning, things like application, analysis, synthesis, evaluation. So how do you do that? I think one of the things you can do is ask good questions. So sort of moving up in terms of higher level of questions. So factual question, what's the most common cause of hypercalcemia? Right, so this is a right-wrong question that your student's either going to succeed or fail. It doesn't require a lot of thinking. You either know it or you don't. A broadening question is, okay, what else do you know about hypercalcemia? Sort of getting the student to be engaged and help you share what they know so you can know what their next level of learning is. Justifying question is, tell me why you think this is hypercalcemia of malignancy. Hypothetical would be, what if the patient didn't have a history of cancer? Then what would their leading cause of hypercalcemia be? So sort of going beyond the case to get the students to think a little bit further. And then alternative would be, what if the patient also had concurrent renal failure? Then how would you manage them? So sort of, again, the higher level of questions that you can use, the more you're going to get out of your group setting. Going along with the ask good questions, I think just like with a patient encounter, you want to ask one question at a time, or a survey. You don't want to ask triple-barreled questions. So you don't want to say, do you have any chest pain, shortness of breath, or fevers? You don't want to say 7 questions to the student. Another thing sort of to keep the mic in the student's hands and not take over is to wait 3 seconds after you ask a question. And that's really difficult. I find I don't like silence, so I try to jump right in. And one thing that Dr. Granaries taught me is that you can sometimes just go like this, 1, 2, 3, sort of keep yourself under control and give the students a chance. And then if they don't give you anything, you can reframe the question. Similarly, you want to wait 3 seconds after the students respond. Because again, the job is not a volleyball game between you and every single student in the room. It's really to get the students interacting. So if Joe says something, you want Mary to chime in and ask a clarifying question or add something or argue with that, as opposed to it going back to you, who probably is more skillful in the topic than the students. And again, you can use this sort of handshake or count to 3 or whatever you need to do to reel it in. Again, avoid putting people in an uncomfortable spot. And I talked about this a little bit. If you ask them a right, wrong, yes, no, factual question, if they don't know it, they can't really save face. So I'll talk a little more about cold calling if we get to some of the other topics later. But I think you want to ask them thinking questions. So where are you stuck? What do you think's going on with Ms. Smith? What more information would you like? Not what kind of an RTA is this, right? Because then they can't really, there's nowhere for them to go if they don't know the information, and you're keeping it at a lower level of question. Again, just like with patients, you want to avoid assertions masquerading as questions. I think that this sort of unconsciously biases the student, so you don't want to get a CAT scan on Mr. Smith, do you? He doesn't need a cath, does he? And so sort of, that's you biasing the case, and you want them to have a fresh look at it without you sort of putting your attending super knowledge into their interpretation. Similar to that, I think, is remaining non-committal. So sort of taking everyone's suggestions into account and using those. Okay, and then one other thing, sort of classic for the Socratic method is ask questions with progressive disclosure. So if you say, what do you think's going on? Why do you think this patient has pulmonary hypertension? And they just look at you with a blank face. Okay, remembering that they have restrictive lung disease. And then you just sort of keep layering on elements. Okay, they've been on oxygen for 40 years. And sort of building the case to help them get the right answer. You can also do a step up approach where you start easy and get harder. I think the fifth theme that you'll see through our content today is to set expectations. And this is a good rule for most educational pursuits, as you all know. Make it a habit, because especially with millennial students, a lot of things that you think are obvious may not be obvious to the student, and it's a lot easier to give feedback if you've already set the expectations. I also think that teacher attitudes have a trickle-down effect on student performance and morale. And so you really want to role model a positive attitude and role model the expectations that you set for your students, because those covert curricular things are stronger than what you say are the rules. Strive for excellence in what you find most important. So some of you may care if your students show up at the exact 8 o'clock hour. Others may not mind if they come in at 8:05, but they want everyone to talk 5 times a session. So you have to sort of prioritize what your big things are. Some people like generic names, some people don't care. So pick whatever you think is most important and set those expectations. Were you going to say something? Oh, sorry. Give feedback when expectations are not met. I don't think I need to belabor that too much. And then the last mantra is really to reflect. So every teaching encounter has high moments and low moments, as you have all experienced. And if you think about all of your teaching encounters as quickly as you can after they happen, that's going to make you a better teacher the next time you give this lecture or this session or another session. I think you can do this by yourself when you're walking away, sort of thinking about how it went. You can also ask your mentors, especially if you had a struggle. And we'll talk a little more when we give out the resources about some of the things that you could do with the Academy of Master Educators, or some websites that will review your teaching to get feedback and help you reflect a little more deeply. And this is a lifelong art, I think, to be educators, and so the more that we do this, the more that we can improve our skills wherever we're starting. Just a quick word about the physical environment. So again, you want to make sure that hopefully you'll have some control and choice over this. You want to make sure that all group members are in a table or in a circle where they can see each other and interact, so that, again, you're not leading the discussion too heavily. Minimize distractions, pages, people coming in and out, etc. Test audiovisual equipment ahead of time, which we showed up 20 minutes to do in the wrong room. So we're living examples.
Know your geography.
Right, exactly right. Know the right room. And then be flexible and roll with the punches if things don't work out perfectly, because there are always unforeseen circumstances, and so try not to let that get you down too much. So any questions about those issues? Things that you guys are probably... Okay, so we're going to try to watch this small group video. This is Dr. McNeil with a group of medical students. You can imagine that it's student teaching attending. And we were planning to just watch this for about 5 minutes. It's not an example of perfect responses to student issues, and it's not an example of a realistic small group encounter. There are many concurrent student issues going on simultaneously in this video, which hopefully you will not experience. But it's just to give you a high-yield look at all of the different things that that can go wrong and how you may address them. So what we'd like you to do is watch the video, watch out for the problematic student behaviors, and then watch what Dr. McNeil does with those, and also what the other students do with those, and then sort of see if think about how you may deal with them if you were in this scenario. And then the students say, oh, we're supposed to have a card with all of our information organized so that we can present clearly, because she's presumably already set expectations.
I think so. You guys okay with this?
Okay. Okay, so then there's some talking about the expectations, and Missy says, so do you want to go ahead, Steve, and try to give a good presentation, or do you just want to bag it and have someone else present today? And so this kid, Mike, in the pink, raises his hand and says, I'll present. I'm ready to present today. And he starts presenting a patient who has hyponatremia, I think, and orthostasis. So sort of, and then you can see over here that the student is sort of doing funny things with her bottle of water as they're talking about volume status and orthostasis. And this student, Sarah, on the far left, is also kind of getting involved in the water bottle. So they're still negotiating who's going to present and what happened. Okay, so that's sort of the deal. So then Mike starts presenting, very organized, very clear presentation. So Missy's still setting expectations and telling Mike.
Okay. So Mike presents. He's doing a good job. They start talking about hyponatremia, etc. These two are doing their thing over here. Missy may or may not be aware of them. She may be choosing to ignore them. We don't know.
You can see there's a smartphone.
On the scene. This kid, I forgot his name. Sean. Is argumentative throughout. Laura comes in late. We learn later that that's not the first time she's come in late.
And she says, wow, Laura, it's 8:20. Thanks so much for joining us.
Happy to have you. So she kind of joins the group. Mike keeps going. Missy throughout is kind of probing the group. And every time she asks anybody a question, Mike chimes in, well, according to the American Heart Association, according to the CHEST guidelines, no matter what the question is, he's answering and he's quoting somebody.
Did they know they're being photographed?
Yeah, they volunteered. This is all a mod. They had some fun with it, I think.
So, he's educating the group, as usual. We're kind of honing in on him. More disruption in the corner. And then I guess kind of other salient points. At one point, kind of argumentative Sean is kind of being difficult and saying he disagrees with everything. And Missy says, why don't you look that up and give us a little presentation tomorrow? And he said, well, why doesn't Mike look it up? And Mike says, I'll look it up. I'll present tomorrow. And Missy says, no, Sean, I think I asked you to do it. And that settles that. And then here she's calling on Sarah, who's texting, and Sarah doesn't know the answer. And Missy says, oh, why don't you think you know the answer? And Sarah said, because I was on my phone. So, okay, so let's put your phone away and bring it in. So that's kind of the dynamic. Sorry for the lack of audio, but I think you guys get the gist of kind of a few different learners emerging. Maybe last point, she does pull Laura aside later and talks to her about why she's bent. So she named it when Laura came in the room, said, oh, hi, you're late. Okay, join us. And then she pulled her aside later and said, this is a pattern, what's happening? All right. Okay.
You can see lots of giggling. What did she do about the water bottle?
She said, you're my jokester today. Don't make me take your water bottle away.
But then they fast forward to another session and she's still sort of goofing off.
All right, so we just want to spend a few minutes talking about kind of different type of problem learners and some strategies that you use that have worked well, have not worked well. So just given that brief summary, what are some of the different types of problem learners that came out in the video?
I think the one who wants to dominate the conversation.
Yeah.
Like I often.
So we had an overeager student who is kind of difficult to keep a lid on. What else? Yeah, completely unprepared, that kind of derailed things from the beginning. And Missy had to decide whether to keep him in the hot seat and the pro or let him off the hook? And what does that kind of say to the rest of the group if there aren't consequences? So that's a tough thing to navigate. Completely disengaged. I mean, she was on her phone the whole time, and for at least half of the video, seeming to get away with it. She didn't. Yeah, she had her back. So whether or not she just didn't notice because she had some kind of problems on the other side, and they were quiet, so they were getting away with it, or she was keeping an eye on them, giving them time to put their phone away. But yeah, definitely. No, just random.
That's spontaneously happened. Did you notice any other problem with learner types that you could label?
Anything that seemed intrusive or disruptive.
Argumentative, adversarial guy.
Yeah, there was a guy who kind of had a bad attitude and was being disruptive and also trying to pass work off onto other people.
He's like, I don't see why the work statics are ever helpful. Just sort of making bold blanket statements.
The girl on the phone, obviously she was looking up something, but it may be disruptive for the facilitator.
Yeah, so that's a
there's
great
dynamic there.
That's a great point. So a lot of times there's the issue: are you taking notes? Are you looking something up? Or are you on Facebook? I usually assume people are on Facebook. Sometimes I'm wrong. Although you have the woman on her phone, yeah. A little bit made for television, on the other hand, is not that far off, I'm sure, from small groups that you've dealt with. Especially small groups that might be a little bit bigger than this. You oftentimes will have multiple problem learners in one setting. All right. So we kind of decided that the 4 that we wanted to pull out, and more than one student might fit into one category, but the few that we pulled out were gunners, so that was Mike, who loved the chess guidelines. Unprepared learner, so that was Steve, who just showed up with nothing to show for himself. Non-participants, so that was the texter, and then disruptive learners. And there were a few different kinds of disruptive learners. The latecomer, the argumentative student, and kind of the class clown. So we just want to spend maybe about 15 minutes kind of talking as a group. Maybe we'll start with 2, pull out 2 that you find particularly challenging. If we have time to do more, we'll do more. Anyone want to pick one to start with? What do you hate the most? Yeah, they're hard. Okay, so let's talk about the gunners. So what's hard about gunners? What makes them difficult?
You don't want to knock them down for trying and being prepared,
Yeah.
but yet they're
Exactly. So sometimes they're really helpful because they can move the discussion along. They give you something when people are otherwise just staring at you. And you don't want to discourage participation. And that kind of gets to also that maybe gunners have different motivations. Some are just overeager and not trying to be difficult.
yeah, so
It's hard to control. You can say, well, let's give someone else a chance. Then 10 minutes later, put back on the salad.
Yeah.
That's to me is the hardest part. It's easy to recognize.
Right.
Say you don't want to discourage them, but it's a nice way to say, look, it's great, let's see if somebody else can do with that.
So you floated out that social cue and yeah, exactly. So kind of highlighting how one student can become a problem in different ways, for sure. And if they just decide, forget it, I know more than you, I'm looking this up. Or I'm going to check out because you're not letting me have the floor. Right, exactly. So how do you not make them feel like they've been singled out and maybe discourage other people?
Mm-hmm. That's a great point. That's a great point. People know their classmates. It doesn't take too long before people sort of develop reputations. And maybe they've been in small groups with that gunner where the facilitator has done nothing and just let them run it. So then they think either I don't need to try or I want to try, but there's no point because this kid's going to take over. So sort of thinking about what strategies you can use for dealing with the gunners, did you notice anything Missy did that you liked? Or things that have been successful or unsuccessful for you? Yeah.
You said that she didn't let you get paid to work for the
Right. One thing that I find helpful is like I think it's called the cold call or something. Like just don't give the gunner an opportunity to answer because I already called on somebody else. Like I expect to spread the wealth by like singling out other people to give answers.
Exactly. And that is that can solve kind of a multitude of problems. If the culture is, I'm going to cold call, when I call on you, you contribute something, that can help shut up the gunner a little bit, maybe draw in the texter. That's a great technique. And if you establish it up front, people aren't paralyzed when you call on. Others?
I'll do a lot of times is I'll ask for a hard question, and I'll say upfront, I don't expect anybody to know this, so I'd like you to tell me what you think about it. So when I cold call people, oftentimes I'll preface it by saying, this is a tough question. Usually it's not a tough question, it's actually pretty easy. I always say,
Lower the bar.
do it all the time. And that actually works pretty well to get more people feeling comfortable, and also sort of sets the expectation of what everybody can talk.
That's a great point, because then you build confidence in people who know it, but if they're wrong, no harm done. It's a great, great thought.
The approach that I use with them is I keep asking them questions, really, really difficult questions.
Yeah.
No, until you get to a point where they don't know what they're talking about.
Right. That's a great strategy. I think especially with the gunner who's aware of their behavior and is a little bit more malicious. I mean, if you play to your strengths, you can eventually, if they're very aggressive, you can sort of pick something and just go to town. That's usually like a second or third line strategy, I think. You know, hopefully you can use it more gentle.
I think it's difficult, like it's different, I should say, handling it within the group, like in the moment and after. Because that's a person that I would consider giving feedback to separately and saying, hey, I'm really glad that you're so excited about participating and you really have an excellent knowledge base. I worry that when you're in a group setting like this and you're always the one answering, that it may make other people feel like they can't participate. So just kind of giving feedback, but that doesn't help in the moment, but it may help for the next time.
Yeah. And I think that's a really important point. You do all these first line things you're talking about in small groups, but a lot of times, like some of you have mentioned, they just don't get it, or they get it and don't care. And that's when you're really going to need to try to nip it in the bud outside of class. When it's appropriate. Yeah. It's refractory to first line. Any other thoughts on gunners before? Yeah. And just calling them out a little bit also makes it clear to the rest of the group that you, as a facilitator, recognize it and don't like it. Do you hear that back there all that? So Dr. Zelensky was just saying that you can make light of it and call it and sort of make it a humorous thing and say, okay, Joe, let's calm down a little bit. Missy, even 10 minutes into the video, says to Mike, she pats him and says, down boy. At one point, which is a strategy that I could probably not pull off, but I think that like after you've tried 8 redirection strategies and the gunner is refractory, sometimes even a light touch or some making light of it, because he's more of a puppy, right? He's not malicious, he's a puppy. So that was one. It's a good one. It's a pearl to be used sparingly. All right, which one you want to go to next? Your second most feared or hated type of problem learner. Julie?
I do want to communication teaching, so I don't have a lot of gunners. I do have issues with non-participants. Okay. And I think that's hard because it makes me feel like they don't care and it makes me devalue my curriculum. That's my gaps about what's going on with others.
Okay, so good. Yeah, and I think no matter what we're teaching, we've all experience this on a regular basis. So what's hard? Julie kind of got the ball rolling. What's hard about those checked out non-participants? Yeah. Right, exactly. That's a great point. It's one thing when you've been working with a group for 2 weeks and student teaching attending, but if it's day 1 or 2 and you don't have prior experience with people, kind of the differential of the problem is pretty broad. What else?
If the non-participants really unprepared, right, then I'm not sure what to do with that. You have to make your question simpler and simpler and simpler.
Mm-hmm.
But these are hard to challenge. One thing is they don't really care, but at least they prepare something. If they're not prepared, then they don't care.
Mm-hmm. Yeah. That's really hard. So what have some of you done with kind of letting the person off the hook for the sake of getting the discussion off the ground, or not, because then in some ways you feel like you're letting them get away with bad behavior? I'm sure it depends on the day and your mood and whatever, but some things you've tried.
One thing that I think is years before, if there was someone who I thought was communicating stuff that I told them, okay, during the next report, I'm going to ask you to give them a summary statement.
Good.
So that they would have a chance to know that it was going to happen and not feel put on the spot.
Yeah, that's excellent. So when you really know that, and that problem's going to be harder to, ideally we'd like to manage everything in real time because then you're done. You don't have to do it outside of class. But someone who's really anxious and kind of struggles with confidence, it's going to be hard to do that unless you kind of give them softballs, which might be obvious.
It depends on part of the size of the group.
Mm-hmm.
If the non-participants in a really big group are just going to get lost.
Yeah.
It also depends on the kind of non-participation. When I do student teaching, I have at least one student block. When I sit down at the end, I say, this is obviously hard for you. You obviously would rather sit with someone not speak. You're really hurting yourself by doing that because nobody knows. Usually it's somebody that's actually quite bright and knows a lot of stuff, and when you ask them questions, they know the answer, but they never volunteer. And I invariably, when I have that conversation, the student shakes their head in agreement. I know. I've heard this 100 times before. And so, one thing I tell them is, you're really hurting yourself. You're really getting undervalued for what you know. That's how you get evaluated in clinical rotations. It may not be fair, but it's true. And you need to walk in the room every day saying to yourself, I'm not just going to sit here, I'm going to make myself speak up. A lot of students have trouble with it. It depends on the size of the group. They do okay in teaching rounds, which is 4 or 5 people, but when it's 8 people, they just would much rather think back. And that's different from the ones texting on the
Yeah.
So there's different kinds of non.
That's great. Joanne?
For that and vision that sometimes I'll take them aside after one of the sessions and talk about, if they're shaking their head, yes, I've been told this a million times, I'll say, in each session, I'll set a concrete goal. I want you to make 2 comments. Just put it in your head, you're going to do 2 per time until it feels natural to you.
free to shoot. I like that.
Another groups what I often do if I see that the other colors I have maybe shy people or students, I just tell them turn to each other and discuss it well. Because that way, by the volume, you see everyone has contributed something, and after that, it's much easier to repeat what they discussed.
So how do you get them to do that? Do you say, okay, Jim and Joe go back and
I
forth?
just
Or?
say turn to your neighbor and discuss.
Okay.
So it doesn't work with four people, but
Yeah.
larger small group, but actually it does work.
Okay. So for people in the back, just say turn to your neighbor.
And then maybe they feel like it's a dead. The shy people maybe feel like it's a dead end by their co-student, and so they have more confidence to say it. Or even if the gunner reports back from the duo, then it's part of what the shy person said. Okay. What about the texter? Forget the phone.
I think that's really hard for a lot of reasons. I mean, I think one is that, and I'm probably guilty of this. Like, maybe they really are using it to record notes or to look stuff up in order to be able to understand better what's going on or participate more. And I think it's difficult when there aren't expectations set ahead of time, whether that's okay or not. Then that's where you sort of run into the frustration as the facilitator. Usually, inherently, we feel like that's not okay, but I think younger learners actually think that that's fair game. And so I think that it's part of that is the expectation set ahead of time, whether it's okay to look stuff up or use your device to record notes or whatever during. Because like you said earlier, the default for most of us as facilitators is that they're doing something else with it, like they're texting or they're looking at Facebook, and that's not always the case. But it's impossible to know what someone's doing unless you set expectations ahead of time. A similar situation is like when we're on rounds, like sit down rounds, when the residents, the house staff, or the medical students turn to the computer. And you can clearly see that they're in the patient's chart. They're not like, Googling something, right, usually. But, even then it can be frustrating because you feel like you're trying to like conduct a discussion or someone's presenting, the medical student's presenting and the resident is turning to the computer and like putting orders in. And that can be challenging and frustrating as well because they probably feel like, well, this is work that needs to get done and these are patients we need to take care of. And so, the sit down rounds aren't sort of this time where you're supposed to shut everything down. So I think the expectations ahead of time is probably really important in that situation because then if you set them and then they break, if you say up front, I don't want you using your phone or I don't want you going onto the computer, and then they do it, then it's easier to call them on it.
Yeah, that's a great point. I haven't done that. I'm gonna try it. Or have you done it?
Yeah, I've started because that's what happens, and I feel bad, and then it takes longer to set the expectation.
I've done this too with the shy person. Is to say, when you get to a point where they're not certain, I say, well, Joe, why don't you look that up right now on your phone? Right. Let us know what you find. So you can use that to advantage. Well, in the discussion or the discussion goes in a direction you're not certain of in the classes and certain others. And that's another way to engage someone who's not. But then once again, you have to set expectations. As you say, where you're not going to use the phone unless you decide to do it.
Yeah, and I think it's hard too, even if it is medically related. In morning report, I remember asking about what monoarticular arthritis, and then some of the residents would start looking in their pocket medicine book, and that's not really the point of a small group either. So it's a slippery slope because I think if you have a knowledge gap as a whole group, you can say, can somebody go outside the group and fill in this gap versus somebody reading it, looking at an algorithm instead of listening to the discussion. So it's tough to negotiate. Great. Okay, so thanks for the discussion. What we're going to do is we're going to tell you a little bit about our thoughts on the non-participants and the gunners and the differential diagnosis and management of them, and then hopefully we'll have a little more time for wrap-up. Okay, so talking about the texters and the wallflowers. So these folks, the problem with them is they speak frequently, if at all. And it creates an imbalanced discussion among group members. And as Dr. Painter was mentioning, in a smaller group setting, this hurts the whole group, especially if you have 4 people, one's presenting and one's on their phone. Those poor 2 people that are still engaged are really being punished, right? To keep the ball in the air. Alternatively, in a larger group setting, like you were saying, it really hurts the learner because they're not advocating for themselves, they're not showing what they know, and they're not getting anything out of the discussion. So if you think about the wallflower or the engaged but quiet learner, so this is somebody that their body language suggests they're paying attention. They're nodding, they're smiling, they're making eye contact, they might be writing things down, they're following for the conversation, they may lose eye contact when you ask a question of the group, but they're with you. And then you have the texter or the otherwise occupied learner who seems oblivious. They could be doing something else like texting, or they could just be staring into space, right? You're wondering if they're having a nap. But something about their body language suggests that they're not with you. So I think the differential is the key to this. So setting expectations, figuring out what the cause is when there's a problem. So for the wallflower, the differential is that this person's naturally shy. Like a few of you were saying, every rotation they're told that they just don't talk enough and they're not comfortable throwing themselves out there. They may just be uncomfortable with the topic. Maybe they hate women or infridities, but they were a rock star yesterday. And I think that when it's not a pattern, it may not be as big. And similarly, they didn't do the reading or see the patient or prepare for the case. Sometimes they're worried about what other people think. This could be great, so they don't want to open their mouth and say the wrong thing because you might give them a pass. They may feel like they don't belong in medical school because they're not smart enough, or they just may feel like they don't want to sound uncool for some reason. Or they may secretly not be paying attention despite the fact that they're nodding and smiling. Right? They're just going through the motions, it's a blank screen in there. So that's possible. That's a little, I feel like I see a little less of that, but I don't know exactly what's going on. For the texter, so this is somebody that presumably they may not value the learning experience. So maybe they want to do pathology and they don't really see why they need to know anything about hypertension, and that's what you're talking about today. Maybe they have an attitude problem. They're a slacker, they're too cool for school, they don't like authority, sort of these professionalism issues that we get into. They could be preoccupied with other aspects of life. Maybe their mother's in the hospital, maybe their baby was up all night, and they can't get it together for group today. Or they could just be oblivious, not care, they're trying to get a pass in every rotation, and they just aren't really interested. So I think the real-time strategies for the wallflower, there are a couple different things that we thought about, and some of these are things that everyone was talking about. So again, creating a safe group environment, and this is a little bit of the knife edge with the gunner. You don't want to squash the gunner too much because it may scare the wallflower from talking. So you want to make sure that it's a supportive, safe environment. Explain the ground rules for cold calling at the first session. Again, saying that you expect balanced participation from everyone, and you will be cold calling if you're not getting balanced participation. And then it's easier to do that and not make people feel persecuted. Invite the learner in. So you could say, Jeff, is there anything else you'd like us to add to the differential? Which is fairly non-threatening. They can say no, there's nothing, that's a great list. Or they can just chime in with something small, and it's a way to just nudge them in. You can also pick up on nonverbal. So if they make that face, you can say, Jeff, I see that you look a little confused on this. Where are you stuck? And then he can say, I don't know what this is. He doesn't have to come up with anything great, but it gets him in. And again, putting them on the spot with rote factoid questions where they can only succeed or fail is going to be more intimidating to them and probably less valuable for the small. And I think, again, starting small and building on success. So like Debbie was saying, or like Joanne was saying, making some sort of verbal contract with them outside the classroom, like, I just want you to talk twice, or I just want you to do a summary statement this week. And then when they do that, they may get in the game and feel more excited. After class, I think this is, again, if it's a pattern, you can find out what's going on. Review expectations that you do expect balanced participation from everyone, and give them feedback, saying that they're not speaking as much as you. And it may be good, as you were also saying, Joanne, to get them involved in how best to involve them. What do they think is a feasible goal? What thing do they want to focus on and put their next step on? In terms of the texter, I think if you move around and stand behind the learner, behind their phone, that would make me uncomfortable. Okay, sometimes you put your hand on their shoulder, and that will hopefully reel them in. I don't use that strategy a lot, but I think it can be pretty powerful. And you can also ask them directed questions. So Missy did this in the video with the woman who was texting. She's like, why do you think orthostatics would be helpful? And she had no idea what was going on. So Mary, what do you make of the petechial rash And if she wasn't up to date reading about petite field grasses, then bingo, that may reward that behavior, but you're probably going to make them feel low. If it's recurrent and due to a benign cause, so they don't have serious things going on in their personal lives, I think cold calling and giving frequent feedback. After class, again, finding out what's going on. If this is a new pattern for the student, there may be something going on at home, and you may be the first person to become aware of this. Review expectations about their participation. I expect you to participate X time today. You're not doing that. Please do that. Try to get some buy-in into what they can get out of the rotation, what they can get out of the small group experience, and why it would be important for their development, and then give feedback. So that's really all. We're not going to talk about this. Dr. Granari's slides are pretty awesome. So I'm going to turn it over to Jen. Thank you.
Okay, so the gunner. As you guys pulled out, not all gunners are malicious. We sort of thought about 3 different types. So some are malicious. And this is the person who comes in and says, I'm going to make it clear I'm smarter than all of these people. There's the well-meaning, but just overly enthusiastic. They're not trying to be a problem, they just can't help themselves. So their inner voice is, I just love anemia, answering questions is fun, this is such a great discussion. And then there's the no filter, hate silence, overly talkative. It's intrinsic renal failure, or pre, could be post, and I want an echo. It's been a second and a half, I'm just going to say it. Just can't shut up, doesn't care if they're wrong. All right, so what's the common ground? All of these types of gunners discourage other group members from contributing. They all make it more difficult to engage the texter and the wallflower. And they can really undermine you as the facilitator from moving things in the direction that you want to move in. All right, so the malicious gunner. I don't know if you guys watch Big Bang Theory. So typically this person is arrogant, frequently interrupts, undermines, contradicts. They're usually smart, which makes it harder. They didn't get to be a gunner by being wrong all the time. They've been rewarded for that behavior in the past. And they want to shine to the detriment of others. They may recognize social cues, but just ignore them because they have their agenda. Then there's the well-meaning gunner. So not arrogant, doesn't interrupt, doesn't insult, but is just really excited, and that's what drives them. They just want to participate because they love the topic and they want to be involved, not really to outshine other people. They're usually smart, and they're usually a little bit clueless because they're not trying to be a problem. Then there's the no filter, overly talkative. I couldn't think of a good TV reference, so I just found this, which I thought was appropriate. I prefer not to. So this person is generally confident but not arrogant. They're not afraid of being wrong, and they may be wrong often because they don't think before speaking. They hate silence. They're not trying to be the center of attention. They just have no filter, no self-restraint. All right, so some first-line kind of real-time interventions, and you guys came up with a lot of great ideas that I'm going to steal. So you can try to selectively ignore, maybe you do that the first 15 minutes of the first day. Most of the time, that's not going to work. Cold calling, this is going to come up over and over again. It can really be applied to solve sort of a variety of problems in a small group. Lighthearted calling out, like Dr. Zelinsky said, I'm really happy you're excited, but let's give other people a chance. Not insulting, but makes it clear you're not loving what's going on. Second line management, you could name the problem nicely if they're really not responding to some of those first line things. We've been hearing a lot from you. Let's give the other people a chance. Just really making it clear they need to cool it. Highlighting a mistake, like someone brought up, that's wrong, actually. Let's give someone else a chance. Not that you typically jump on wrong answers and highlight them. Once in a while, you may need to. And the concept of if something's wrong, not letting, especially if it's a smart person, not letting other people think maybe that's correct. And your new best friend, hold that thought, Jim, and you may or may not choose to come back to it. And we all know who perfected that. Taught us well. All right, and then third line outside the small group. Not necessarily third line, probably not first line, but this can be in combination with some of the second line things. You're not going to obviously do this if the person is responding well to kind of the interventions within the small group. And your approach is going to be different depending on which type of gunner you think you're dealing with. Naming the problem may be enough, especially for that well-meaning gunner. If you say, it's great that you're participating, but you're discouraging others and making things a little bit tougher, sometimes that's enough if they just don't have insight. You might choose flattery. It's very clear how advanced your knowledge is, but it can be intimidating to others, and you can help me encourage the other students to participate. Depending on the differential, you may not choose flattery. You might say, you're making my job more difficult, you're detracting from other people's ability to participate, and you have to tone it down. So, final thoughts. Gunners are a part of life. You can't prevent them or avoid them, but successful management is rewarding, and once you can kind of perfect some of these techniques, you can use them over and over again, because as we know, gunners are everywhere. All right, so just to wrap up, and then we'll have a few more minutes for other thoughts from the group. Common problem learners, emerge in most small groups. You probably could have guessed what we were going to talk about today. And the diagnosis may not be immediately apparent, and if you misdiagnose that learner, if you assume the person is just rude when they're actually very anxious, it's going to be tougher, just as when you prematurely close on any diagnosis. Interventions outside of the group have an important role, but they should generally be second line. And really, we think that a framework of strategies can really be, if you have kind of an arsenal that you can just employ over and over again, it can make things a lot easier. It can also be applied to small groups of faculty. I'm sure you've all had meetings with faculty members. It's not necessarily going to be the same strategies, but potentially some. And, we were very spoiled as fellows, is that we had somebody observing us. And, it's probably not something that you think about as faculty, but people from the Academy of Master Educators, Missy, Roseanne, and others would be happy to come watch you teach. And a lot of times when it would happen, Missy would say, I think if you do this one thing a little differently, it's going to make things a lot easier. And then she'd be right, and it would. All right. So we'd like to thank Missy and Roseanne, who taught us a lot, and Roseanne helped us with this presentation. And we have a few more minutes for any final